My name is Patrick. I'm a physician working in Fresno. So this is my audience here?
Yeah.
Okay. What's your name?
Kelsey.
Kelsey, how you doing?
Good.
What about you?
Kayla.
Kayla. How you doing?
Lisa.
All right.
Linda.
Michelle.
Okay. And the pastor.
Yeah, Dan.
All right. Anybody took a CPR class before?
No.
Yes. Linda, she's a nurse.
You're a nurse.
Yes.
You're an active nurse. Okay. All right. But you did? You did?
Yeah.
Okay.
You want to teach you now? I have taken it. I was studying now.
All right. It seems like for the guidelines, the number one says that the person that successfully complete a class sponsored by the American Heart Association, American Red Cross, equivalent of a certified instructor in order to properly learn and demonstrate one-person CPR. But so basically, it's only restricted to one-person CPR. All right, because first of all, you guys understand what CPR is? No.
Cardio, pulmonary resuscitation. Cardio means heart, pulmonary, that means your
Lungs.
lungs.
Yeah.
Resuscitation, you want them to.
So after defining that, do you know why you're taking that class today?
I'm on this asking question. You said, I don't know. Or
Yeah, it's okay.
My auntie brought me here.
I
I
don't
don't know.
For the Pathfinder, you need
Everyone
it.
is to answer,
For
and
the
then just
Pathfinder.
immediately the kids,
Yes.
you guys are on the stage.
Yeah.
Do you guys know why you?
Because you're the future.
That's it.
Because you are Pathfinder, you
Because
have to take it.
because if when I become an old man, I got a problem. If I'm on the side of the road, you're gonna be an adult at that time. All right. So basically, the reason you are here is because you have millions of people suffering from what we call cardiopulmonary arrest. Cardiopulmonary arrest means the two main organs in your body, okay, which keep you alive, your heart and your lungs, okay. When they stop functioning, that's it. You're done. Okay. In the past, what happened is. In any situation when somebody got a cardiac or respiratory arrest, the recommendation was just to call 911. To call 911 and everybody's sitting and standing on the side of the person, waiting for 911 to come. You know what the average time for the ambulance to show up? It depends on where you are. In a big city like Santa Rosa, if you call 911, how long do you think the ambulance will come to show up?
30 minutes.
30 minutes.
Nah. If this is a real emergency, within 5 minutes,
That's
they should
5
show up.
minutes. 5 minutes.
Within 5 minutes, they should show up. But that doesn't mean we are human, all right? That doesn't mean it's gonna happen. That's why they realize when people suffer from cardiac arrest, the longer you wait, when these people they bring them to the hospital, the longer they waited, the more likely they are to die. Because time is important. If the ambulance shows up in 5 minutes, in 3 minutes, better for the patient. But it shows up
See
in...
where we are, because other parts, it's more.
Yeah, if you knew all area, it will take longer. If you live in the mountain, it will take longer. That's why teaching people how to do some basic intervention when somebody, you suspect somebody got a cardiac arrest, it will save that person's life, even though you're not a healthcare provider. All right. So now to understand what CPR is, you have to understand the functioning of human body. So the main organs are the lungs. They are inside. Okay. You have a marker.
Yes, it's on the.
Okay. Yeah.
No.
So you have. This is a chest. That's the chest with the ribs. Okay. And inside the chest. Any one of you wants to become a doctor or in healthcare? Why not? You don't like to help people?
Yeah, Kelsey.
Kelsey?
Oh,
Kelsey, so you like to help people?
What do you want to do later on?
I want to be a dentist.
Dentist. Okay, that's good. You still have to deal with those things. Because it's going to give medication to people which can cause problem. Okay? How about you?
Me?
Mm-hmm.
Flight attendants.
Oh, you need to know that too.
Yeah. Oh yeah.
Oh, because that happens all the time in the air. Alright?
Yeah.
And they will ask for, they will always for whoever is in the airplane, is a doctor or nurse or is certified in cardiopulmonary resuscitation. And you will be famous. Yeah, they'll give you first class
See.
seat. Yeah. How about you?
Lawyer.
Yeah.
Lawyer.
Lawyer. Oh. So we got to be very careful. We do the right thing because he's going to go after us.
I don't want to go after.
Alright, anyway, so inside the chest you have your lungs. These are two spongy organs, okay, responsible of your breathing. And whenever you talk about breathing, you can talk about oxygen. This is life. Without that, there is no life, okay? So when you breathe, the air goes to your lung, and then you get oxygen. Alright? You breathe in oxygen, and you exhale carbon dioxide, which is toxins. Alright? But you need the oxygen to be alive. Alright? How do you get the oxygen? How does it go to your body? So you breathe it in. You have to have your heart. It's inside the chest. No red. Let's make it blue. So that's your heart. You got four chambers, but two main chambers. The heart got to pump the blood, okay? It's a completely closed circuit, alright? So you have right heart, that's left, that's right. So the main heart is the left, which pumps the blood to your whole body. Okay, you breathe in oxygen, the left heart got blood in it, it pumps it, alright? The blood coming from your lungs, when you breathe the oxygen, it's oxygenated. It's full of oxygen, it's for your body. Without oxygen, your brain will die, everything will die. So the left heart take that oxygenated blood and then throw it to your whole body. And that's why I'm here talking, we are here talking and interacting, okay? So the left heart pump the blood, goes to your whole body, alright? And then when that oxygenated blood goes to your body and is processed, when something is processed, what comes out of it? It's toxins, alright? So it's processed everywhere and then the toxin comes out and the main toxin is carbon dioxide. And when the blood full of carbon dioxide, which has been processed, it comes to the right heart. Alright, it's closed circuit. Right heart, and then the right heart pumps the blood where? To the lungs again. And then the lungs exhale carbon dioxide, which we don't need, and then takes the oxygen again. It's the same cycle from the time you're born, you take your first breath until you leave the earth. This is the same thing which is going on, non-stop. Alright? And it wasn't created by
Oh,
human.
that's just so amazing.
It was not created by human.
That's right.
Nah, God.
And we try to explain creation. How can we explain creation? We are not even there when it was created. Huh?
That's
We're
right.
trying to explain something. We try to explain something we didn't even witness.
That's right. You have to take it by faith.
This is a big lie. I didn't. It's like I tell you something right now, and then you turn around and you tell people, you know, this is what I know about this. You know, I did it.
Yeah.
This is the same thing. We didn't create human body, and then they turn around and try to explain creation. It's impossible. Anyway, so the blood goes to the right heart, goes to the lung again, gets oxygen, and then the cycle continues. Okay? That's what keeps you alive. Alright? So, while we are here today, it's, you know, we are human and we are bound to be sick. Alright? Isn't it?
Mm-hmm.
We're not healthy all the time. So, if we go by Mrs. Alfreda's paper, So, do you understand the location and function of the heart and the lungs? Do you have any questions so far? It's within the chest, and it's protected by ribs. It's for no reason, because if you have your heart and lungs and they are not protected by hard core tissue, bones, it would be easy to get damaged. So that's why it's protected by what they call rib cage. It's a thoracic cage, all right? So it's in that cage, it's protected. So this is where the heart and lungs are, okay? So location of heart and lungs and function. Any questions?
So the heart is not the center of between those two lungs, but a little bit left side, right?
Yeah, it's a little bit slanted to the left. Yeah, that's why the left lung is a little bit smaller than the right lung.
Oh, okay.
Yeah.
I didn't know that.
Yeah,
Interesting.
but we're not here to make you being expert in medicine, or we're just into understand the basic function of these organs and why we are having the CPR class. Okay?
There's gonna be a quiz after that. You better be taken in.
All right. Okay. So if you don't have any question about this, we're gonna move forward.
So what is difference between a heart attack or heart arrest? Is the same concept?
No, it's not the same thing.
Oh, okay.
I think we're gonna go over this under the 5 conditions under which it can be. It would be used. We can talk about that for your curriculum, for your agenda. Very good. All right. So we understand that. All right. So now next it's define CPR and tell 5 conditions under which it would be used. So are we clear with the definition of CPR? Cardiopulmonary resuscitation. So cardiopulmonary resuscitation is cardiopulmonary, heart and lungs. Okay, the main organs keeping you alive. Resuscitation means what?
Bring it back.
Yeah, bring you back. So what would happen for somebody to need cardiopulmonary resuscitation?
When heart stops.
Yeah, the heart.
Yeah, the heart stops or you stop breathing. It's both.
You choking.
oxygen.
Yeah, choking.
Okay? So
You choking.
whenever there is a problem, when somebody can't breathe or the heart stops, okay? Can't breathe or the heart stops, this is when you have cardiopulmonary resuscitation, all right? But there are two level in what we call CPR, okay? One of them is what we call basic life support, all right? And the other one is called advanced cardiac life support. We're not here for advanced cardiac life support. We're here for basic life support, okay? Basic life support, it's the basic intervention that you can make as a bystander or family member or church member, wherever you are. Something happened, the basic things that you can do to
Keep them alive.
improve somebody's survival when the advanced providers they arrive, like EMS, and then taking patients to hospital. Okay, it's what you can do to give that person a second chance. All right. So basically, we are here for BLS as part of the CPR, not really for advanced cardiac life. Advanced cardiac life support, it's when EMS arrive, the patient gets to the hospital. This is when they get medication, they get they have advanced airway placed, like they put tube in their lungs to help them breathe, giving them medication to support their heart. That's advanced cardiac life support. When they shock them, that's advanced cardiac life support. But that's not something that you're gonna do. All right? We're gonna explain to you what you're gonna do as basic life support with cure. Okay? And so I think we are limited to one person, one with cure. That means you are home, and then the grandma falls on the ground. All right, and the question is, what do you do? Okay.
I call it.
You call 911. That's good. All right.
Easy
Yeah.
solution, huh?
Yeah, that's what we used to do in the past, because you remember I told you when we call 911,
Takes 5
it will
minutes.
take, let's say it takes 5 to 10 minutes. What you gonna do?
You have to-
Look at grandma?
In the meantime.
I try to help my grandma.
Help? Good. How would you help your grandma?
I.
Mm-hmm.
Jesus,
By
I'm doing
CPR?
this.
Yeah, by
Go ahead.
Wow.
I put my grandma.
What's that?
You have to make sure you have. This is your grandma. There's something.
Oh, that's grandma?
Yeah,
Oh. It's grandma, I'm sorry.
Okay, let's go with grandpa, since grandpa is not here.
No, in fact, that's a good idea. When you are in doubt, that's what you do. You do CPR, but that's not really the first thing you do. In fact, there is what we call an algorithm about what you're supposed to do. In fact, you can give them a copy
Okay.
of this.
Oh.
If you have a copy machine
Yeah.
here, adult basic life support. Yeah.
Yeah, how many, okay.
There's 6, 7, 8, 9, 10.
You can
That's there. Oh, 9. He doesn't need one.
So the first thing you do when somebody passes out, okay? It doesn't matter where you are. So where do you think something like that might happen? Where do you think you might be and somebody passes out? Where?
Choking.
Location. No, I'm talking about location. Church. All right.
Anywhere.
Supermarket. Anywhere. Okay.
Home.
Work.
Paying attention.
School.
Yeah. School.
Work.
Anywhere.
Shopping center.
All right. So it can happen anywhere. All right. So that means you have to be ready. And if you understand those basic things, you'll be able to do something. So the first thing that you do, so we're gonna go over it. All right. Let's see if you're on the side of the road, all right, and you see somebody lying down, you want to be a good Samaritan, okay? You might stop the car and go to that person. The first thing you do is, it's very important that you are safe and the person is safe, all right? That's why they advise you to verify the scene for safety. So if you're gonna help somebody, you have to be safe. If you're gonna try to resuscitate somebody on the side of the road, you're in danger. All right, cars are passing by. That's not safe. So we must verify the scene. You have to be safe before you start helping somebody. That's number one. And these things, they happen within seconds. All right. And then the next thing you do, you have to call grandma. You have to say grandma's name or grandpa's name.
Okay.
You tap grandma.
Ask them, are you okay?
Are you okay? All right. All right. If grandma doesn't respond or respond, that makes a big difference. Okay. And the other thing you do, you have to do very quick, and they come within seconds. So safety, you check for responsiveness by tapping and shouting name. And then you have to call for help. You do all those things at the same time, because the more person you have, the more likely you're going to be able to implement whatever is going to come down. Because one person versus 2-3 person makes a big difference. Okay. And then you activate the emergency response system, which is the 911 that you said. Okay. That means if you're there, grandpa passes out. Okay, you call his name, and then you tell somebody. If you're alone, you're gonna have to do it yourself. But if there is a second person, you tell somebody. You call that person and then tell that person call for help. Okay, all right. That means you're gonna call 911. Okay, or if you have your cell phone, you can call 911 yourself.
Doing that.
Okay? If you're in an environment like a school or anywhere, because there's something they call AED. Have you ever heard of that?
I see it everywhere.
Hmm?
I see it everywhere.
But do you know about AED, the existence of AED?
You don't know. It's a
You don't?
No.
Okay. Yeah, what happened is because
Talking to you.
because they realize time is very important. All right? Time you get somebody back when somebody got a cardiac arrest. By the time you wait for the ambulance to come, some people they require to be shocked. All right? So instead of waiting for the ambulance to come, they put the same machine, they shock these people, they put them in school, stadium, anywhere where they're going to gather a lot of people. So you have to know that. So you tell somebody, call 911, and that person will go and get what they call the AED. It stands for automatic external defibrillator. It's a defibrillator. Defibrillator means to defibrillate the heart, to shock the heart, to get the heart back to normal. But it's automatic. It will do the job because they know that people don't know how to do those things. But the machine, it got its own intelligence. All right. Before even the AI came out, the machine got its own intelligence. You apply the pads on the person's chest, and then the machine will analyze the rhythm, and then we'll know if a shock is to be delivered or not.
Oh, really?
And the machine will tell you.
I didn't know that.
The machine will tell
Tell you
you.
everything. He talks to you.
The machine will tell you.
Oh.
Okay. This what I see needs to be shocked, and to shock everybody got to be away from the patient. The machine will tell you to clear, get away.
Clear. Get away.
And then you press the button, and then the machine delivers the shock. Okay? So they call that AED. So if you're in an environment and there is that stuff, you have to get it 911, and after 911, they get that machine. All right? In the school, we get that AED, and then when you come, you apply the pads on the chest. The machine will show you exactly where to put the pads. In an adult, it's right. It's right here and here. For a baby, an infant, it's back and front. All right. So you call for help, and you get that machine called AED. All right. So now, the next thing is all those things happen within seconds. Okay. So the patient is on the floor. So you have to look if that person is breathing. How do you look how do you know if somebody is breathing or not?
Yeah, looking at the chest.
You look at their chest, you look at their
Mouth.
Chest rise.
Their mouth, see chest.
If somebody is breathing, you will see.
Yeah.
That's how you count how many times somebody breathes per minute, by looking at that movement of the chest. Rise up and down, okay? Because the lungs, they're like a balloon. When you breathe in, it inflates. When you breathe out, it deflates, okay? So that's how you know that. If that person is breathing, that's that thumbs up for that person. But if you see that person is not breathing or gasping for breath, that's a problem, okay? The next thing is, this is a key to life. Breathing is the lungs, and the next thing is the heart. How do you know if the heart is working? It's the person that got a cardiac arrest. Is by checking the pulse. So breathing is chest rise. Okay, you have to look at it to see if that person got chest rise. And then for the heart, you have to check for the pulse. That's very important. So how do you check for pulses, do you know?
Come on, Kayla and Lisa. We did it 2 weeks ago.
Yeah.
You remember when you ran and I asked you to check the pulse? What did that? There you go. All right.
So where do you check it? Tell me. It's very important to know where you check it.
My home.
You need to know exactly where to check it.
Oh.
Alright. Okay. So let me tell you, in fact, this is not really the place where you check it, but normally if you put your finger right here on the outside, you will feel your pulse. It's called radial pulse.
I check
Go
my
ahead.
neck.
Go ahead. Let's go one step at a time.
We don't do that.
Radial, right here. Check your own pulse. It's outside in the groove, right here. You need to know, right here. you'll find it.
And you find
You don't have to think about it. No, not here. Right here. Put your hand right here.
where the pulse. Oh, Kelsey find hers.
Kelsey, very good.
That one.
Right here,
Index.
outside. Put 2 fingers, and then you feel something. That's your heart beating. Can you feel it? Okay, let's call that radial pulse. But when somebody is in cardiac arrest, this artery, so it's not really that big, and then it's so far away from your heart. We don't check that pulse. That's not really the most accurate one to know if somebody got a cardiac arrest. Okay, where you go for an adult who is unresponsive. Okay, all those things are being done within seconds. All right, look at the breathing, check the pulse. You go to the neck. Okay, you need to know exactly where to put your finger. You see where your airway is? Right here in the groove. Alright? It's called carotid artery. Okay? No, it's not on the muscle. It has to be on the groove right here. And then you will feel. No, not outside. It's inside. In the middle. Right here. No, Kelsey, right here. Not in the back, in the front. Move your hand to the front. Right. And when you learn how to find it, it will be easy to find it. Okay?
See? I find it on here.
Okay.
There's no beat over there. Besides this.
She feels
Yeah, it's called carotid pulse. So that's how you check if somebody is in cardiac arrest. You put your finger right here. And the other place you can check it, okay, it's the person's groin. Alright? It's where the legs join the belly, and there is a crease where there is a big artery, and you put your finger in the groin, and then you'll feel the pulse. Alright? This is neck and groin. Alright? You don't really use that one to check for somebody who's pulse in cardiac arrest, because that artery is not that big. These are big arteries. Alright? If you don't feel a pulse here, that's big trouble. If you don't feel a pulse here, if somebody got low blood pressure, it might be difficult to feel it here. Alright? But if somebody's in cardiac arrest and then you don't feel anything here, that means that person is in trouble. Okay? And usually when you check for the pulse and look at the breathing, how long you should wait before you say, my loved one is in trouble. Breathing and pulse.
You don't wait. You don't wait. You can't wait.
Now what's the limit? It's 10 seconds.
Wow.
There is no
10
limit.
seconds.
10 seconds.
There is no limit.
10 seconds. That means for you to look for these things, okay? Within 10 seconds, if you're not sure, you don't find there is no pulse, okay? What I'm saying, they give you the chance, because if somebody got a pulse, you don't have to do CPR. That's why they put it 10 seconds. Because if somebody got a pulse and you do CPR, it's useless. If I put my hand here and I feel pulse, there's no reason to do CPR. Alright? That's why they tell you 10 seconds. If within 10 seconds you do this, and then if you don't know how to do it, and you put your finger in the wrong location, you're not going to feel any pulse, they tell you, know what, you have 10 seconds to do it. After 10 seconds, what do?
Put that machine on and call it a day.
Then you start CPR. No, you start
The machine is
CPR.
not doing CPR.
You start CPR immediately.
You can tell them the machine is not doing CPR.
It's doing
Even
your heart.
though you have the machine, after I can do
Yeah.
start CPR.
The
The machine is going to tell you that if you need
the machine is there to shock.
to shock, not
the
to
patient.
Got it.
Yeah. So they give you 10 seconds to find these things, okay? All those things that you do that we talked about, 10 seconds.
Wow. 10 seconds.
Fall on the ground, shout, ask for help, send somebody, call 911. Is that person breathing? Is that person got a pulse? 10 seconds. Within 10 seconds, boom.
You do CPR.
You start CPR. It doesn't matter what happened to the person, you're not going to hurt that person. Alright?
So is it possible that even if we can detect a pulse, but the people can't breathe? Is it possible?
Oh, in fact, what happened is these organs, they work together.
Oh.
That's why they call it cardiopulmonary. If your heart stops, you will stop breathing.
Oh.
If you stop breathing, your heart will stop.
Oh.
Sometimes
Alright.
you have to check also if there's anything
Obstruction
in
of the mouth.
obstruction of the mouth that can happen also.
Yeah.
Oh, it happens instantly?
Uh, it's not really instantly because what happens is it depends on the cause of the cardiac arrest. Right? What's the most common cause of cardiac arrest in the United States?
Heart attack.
It's heart attack. Right? When somebody got a heart attack, what happened is the rhythm they go in, it's so lethal that immediately the person loses pulse. Alright? So in some other conditions, it might take time for you to lose your pulse. Like somebody is dehydrated, blood pressure is low, and you don't do anything, keep going lower, lower, boom, and then that person got going, like that
Yeah.
might go into cardiac arrest. But like when you have what we call those lethal cardiac arrhythmia, when your heart really stops, yeah, you lose your pulse and you stop breathing immediately. That's why in the hospital you see them calling code blue on patients who are doing just fine in front of you, and then boom, they go down. And then they stop breathing, and their heart stop working because of the condition. Somebody who got big blood clots in their lungs, their heart will stop and they will stop breathing right away. Alright? So it depends on the condition. Some life-threatening condition won't give you any chance. That's it. And if you don't do anything within those few seconds, that person will die. It's just a matter of minutes. So now when you check pulse and breathing, this is very important. This is what will determine what you're going to do for the patient, okay? So the person is on the floor, all right? You go and shout for help, and then that person is responding to you. Say, my name is Joanne, and then you check for pulse. There's a pulse and the person is breathing. What do?
Wait for 911.
Yeah, you call 911. The person passed out, which is, there must be a reason why the person passed out. So you just stand by the person and then wait for help to come. Okay, while you're watching that person, because that person can go down again right in front of you. Okay, so you stay there, make sure that the person is awake. All right. If the person is awake, that means breathing is fine, heart is fine. If the person is awake and talking to you, you don't even need to check. All right. But if the person starts becoming unresponsive, all right, or cold and clammy, or confused, there must be something wrong, okay? But if the person is awake and now talking to you, telling you that exactly where the person is at, there is no problem with the heart, there is no problem with the lung. That means the brain is being perfused with good blood flow, no problem. All right? So the other scenario is you check the pulse and breathing, okay? You see that person is fighting to breathe, and you check the pulse. Where do you check the pulse again?
Come on, listen, Caleb. What do you check?
Carotid artery.
What do you check the pulse?
You don't use your...
It's front. It's the front. Yeah. Very, very, yeah.
The front Kelsey. The front Kelsey. Here.
Right, good. Right here. Where there is a groove. This is where the artery lies. In that groove. And so you feel the pulse, but the person is fighting to breathe. What do? There is a pulse, okay? You don't do CPR.
Yeah.
But the person is fighting to breathe. What do?
Start doing that CPR.
No.
You don't?
No.
What do you do?
No, the person got a pulse. So you check the pulse, there is one. So there is no CPR.
But if they're fighting to breathe, what do?
You do what we call rescue breathing.
Right.
That's not CPR. That's not CPR. That's not
You have the C.
cardiopulmonary resuscitation. It's rescue breathing.
Rescue breathing.
Yeah.
So you do rescue breathing.
Yeah. So when you do the rescue breathing, why do you do it?
Mouth to mouth.
No, why?
Why?
Oh, why?
To get
You try to get air into the lungs.
Yeah, to get oxygen.
get oxygen.
To get oxygen in the body. Because if you're not breathing, you don't have oxygen. If you don't have oxygen, what will happen?
You
The brain
die.
will die.
You'll die. So you need to get that oxygen in that person. So the issue is when you're giving the oxygen, you're gonna use this. They have devices. They have what they call pocket mask. They have back device. All those things. The helpers will come with them. But if you are at home, you can do mouth-to-mouth breathing, there is a rate to deliver the breath, okay? When you deliver the breath, it has to be
What?
delivered in 1 second. That means you not over breathe on that person, okay?
Yeah.
When you give that breath, it has to be very quick, okay? And you have to give it if it's an adult, it's every 6 seconds, okay? Are we following? Hello?
Guys, anybody awake?
Yeah, so when you deliver that breath, okay? You breathe, that breath you deliver it in 1 second. And then, and that's in 1 second, is and there is a way to deliver the breath. We'll talk about it because you have to make sure that the airway is open, that
And then you get to do it.
the
So
air
listen.
goes to the lungs.
You're gonna do it next.
Yeah, and when you do it, the way, how would you find out that the breath you deliver is right?
When that
It's
light
good.
comes on. That's all I know.
What's that?
When that light comes on.
Chest.
No.
The chest has to come
You'll
out.
see the chest rise.
Chest, right.
The
Oh.
same way when you're breathing
Okay.
normal. So you don't have the chest rise. If you don't have chest rise, that means it's not good. You have to keep doing your maneuvers to open the airway. Alright? Because when somebody passes out, one of the things that happen is the person is asleep, not controlling the airway, and the airway is obstructed by your tongue. And then you can, if you deliver breath in somebody with their neck like this, the airway is not going to go down. You have to extend the neck. The airway will be open, and then whatever breath you deliver, it will go to the lungs. And then you keep delivering the breath, rescue breathing, until your 911 that you already did. All those things you already did, you're waiting for those guys to come. And then they will deliver advanced level of care when they come in. All right? So the rescue breath, that's one of the way you can save somebody's life. Just by, let's say somebody drowned, you're on the beach, somebody drowned, and then they bring that person on the shore, and that person is unresponsive. You can save that person's life by delivering those breaths, because that's what the person needs. Don't try to get water out of that person's lungs, don't try to do anything. The only thing you have to do is rescue breathing. That's it, a drowning person.
Thank you for saying that because I'm just turning upside down and get the water out.
No. Not gonna do anything.
I'm glad. Thank you. I'll scratch it out of my library.
They need oxygen. That's all they need until you get them to the hospital.
Because
Oxygen.
I've seen that usually when they do that, like as soon as they get the air in their lungs, they start to breathe, the water will automatically come out.
Yeah, in fact, the human body in fact, somebody even who's been underwater for a long time, they don't even get too much water in their lungs because of the protective mechanism that you have. So trying to get the water out, that's not the point.
Okay.
These people, they don't have any oxygen. You just deliver oxygen to them. That's it.
I'm just a rookie.
Yeah. Alright. Okay, so
Very good.
so we go from the person got a pulse. So we got a pulse and no breathing. Okay, what do? You do rescue breathing. That's how you can save that person's life.
Now, you're gonna give us ratios, you said every 6 seconds?
Yeah, for an adult, it's one breath every 6 seconds. For a baby, the way they define baby is less than 1 year old. It's one every 2 to 3 seconds. It's quicker. Okay? So I hope we don't have to do that for babies, but things happen. All right. So rescue breathing. So that's 1. 2. The other scenario that you will have, it's we said we didn't. So we have the normal, we have pulse and then normal breath. We don't do anything. You wait for help to come. So the next thing is you don't have any pulse, and the person is having trouble breathing. What do?
You do CPR?
Yeah.
We need to see.
You start CPR immediately. Okay? So you check a pulse. Where do you check the pulse?
Right here.
Neck.
You have to keep repeating it. You know how many times I have to take that pulse? ACLS?
How many times?
Every 2 years you have to renew your certificate.
Oh, you mean to do this? Yeah, I thought you
So
said.
to take the class, in fact, to have to be privileged in a hospital, you have to renew your certificate every 2 years. It's not just it's the whole thing, the ACLS thing. It's like you have to go over the whole
It's like
program.
we have to take as teachers the abuse.
Yeah. So no pulse, no breath. What do? You start CPR. So when you do CPR, you by yourself. All right. You by yourself. It's one rescuer. That's what the guidelines say here. It's one person. So when you do that CPR, how many times you gonna press on the chest?
I don't know. I forgot. I haven't had this
Yeah.
class for the last 5 years.
If you by yourself, usually you're on the side of the patient. Hello? Hello?
Guys,
Usually you're on the side of the patient. When, like, if somebody's unresponsive, you don't get to that. You by yourself, you don't get to that person's head, leg. You're on the side because that gives you access to the chest and to the face. Okay? So the compression when you do CPR, it's 30 compression. Every 30, you have to count every time you press. 30, and then you go for rescue breathing. 2. 30, 1, 2, 3 until 30, and then 2 rescue breathing. Each
for every 30 compression.
for every 30 compression, you do 2 rescue breathing.
I remember this. I
Okay?
have this in my head.
And for how long do you do that? Because when you do that, you have to recheck on the patient to see if the patient gets better, if the patient is still bad, while you're waiting for those experts to come.
Help.
Yeah, you do listen to that. So you do 30 to 2, 30 compression and 2 breaths. And every 2 minutes, you have to recheck on the patient. See if the patient is awake, and we check the pulse. How long you have to do that?
Till somebody comes.
No, for how long did you do the check? After every 2 minutes, you do that. How long it takes you to check the pulse again? 10 seconds.
10 seconds.
Because the reason they do that is because people will waste their time trying to check pulse.
Yeah, that's
Let's see.
back.
Let's see if
The person could die in the meantime.
that's right. Let's see if you spend 1 minute, 2 minutes checking the pulse, you're losing time. Okay? Because when you're doing chest compression, you know why you're saving these people's lives? Why?
We can live
No, why? How?
by the air. You keep
Yeah, you're
the air.
providing the oxygen, which will go to their major organs, brain and heart. And when you do the chest compression, what do?
Keep the heart going.
It's blood.
Yeah,
Yeah,
keep the
you
heart going.
replace the heart function. The blood is flowing, going to your brain and all the major organs. That means you prevent a lot of complications. If you don't do that, the person either be dead at the scene or go to the hospital be in bad shape, not able to recover, or if you recover, it'll be in a vegetative state. So the sooner you start the CPR, the better it is for the patient because you're providing blood to the organs. Okay? So 30 to 2, 30 compression, 2 breaths, all right, every 2 minutes, all right?
Check.
And 10 seconds, after 2 minutes, you check again. 10 seconds, you check pulse and then you check this one. If you don't have a pulse, what do?
Continue.
You restart CPR again.
Continue to do
All
So
right?
you guys need to write that down because you're going to come over here and do that. You need to write 30 presses, 2 breaths.
And it's there also.
Every 2
You
minutes,
can
check.
see it there.
30 presses, 2 breaths. Every 2 minutes, you
32
check.
breaths.
That's what that's there for you guys to do.
It's over there.
And then while you're waiting for help to come, 80 to come, when the 80 comes, you put it in place.
30.
All right? Then the 80 comes, you put it in, and when you're doing all those things, you try not to interrupt the compression. And all the CPR process, you try not to interrupt it too much. Right? Somebody can put one pad boom here in 2 seconds while you're doing CPR. Put the other part here. You don't interrupt CPR
Because you're doing
because
the
of this.
breathing.
Because what you need it's
You're
blood
breathing for
and
it.
oxygen. Okay? So let's see what
30 compressions.
I don't think we're gonna go over too much of the AED because I think it's yeah.
We just need to practice that
Yeah.
basically.
Alright. So to complete these things, so we talked about the cardiopulmonary arrest, what you can do if somebody becomes unresponsive in front of you. Can you guys tell me what kind of condition can make, because according to this, you have to name 5 things a person can, no, 5 conditions under which CPR can be used. What can happen for you to decide somebody needs CPR?
Go ahead, guys.
Come on, boot it up.
Do you understand the question?
Give it to her.
Why would you decide to start CPR on somebody? What kind of conditions? What can happen to somebody to pass out at home and for you to decide to do CPR? No breathing? So what would make them not breathe?
You check a neck.
No, I'm talking about the condition, the
Like if they
diseases.
shock, if they have shock, if somebody's drowning, if somebody has a heart attack, those are what he's asking about. What would cause a person to do this? Choking?
Yeah. What can happen to?
As a bad news.
Yeah, bad news causing a stressful situation might cause what they call a syncope. Yeah, you're right. That can happen.
Someone, for instance, if someone is sitting right next to you on the table, you're all eating,
Yeah.
and then all of a sudden the person hold their neck, they can breathe. They seem to be in distress.
Yeah, are that allergic?
Choking. They could
Choking.
be choking because of an allergy to
Yeah.
food. Absolutely.
Yeah, allergy, severe allergic reaction can do that, but choking is very important.
That
All right,
requires-
choking, allergy. What else? Not the severe allergy. Okay, but somebody what they call anaphylaxis.
I got that one.
Okay, so what else?
That's great.
Okay, what can cause somebody having no pulse? Heart attack. Okay, drowning. If somebody got a stroke,
Yeah.
if somebody's an alcoholic who goes out and drink, binge on a lot of alcohol, they would come and then pass out at home. Okay, somebody using drugs, they would pass out on the street or at home. Okay, people using even prescribed medication, pain medication. All right, you have hundreds of thousands of people dying in the United States every year from what we call opioid overdose. It's pain medication.
Accident also.
All right.
An accident that can happen also.
Yeah, if there is an accident on the side of the road, yeah. Trauma, yeah, or what we call cardiac arrest. All right. Somebody taking medication he's allergic to, okay, might cause a cardiac arrest. So a lot of things can do that. So you need to know at least 5 according to the recommendation here.
5. You are choking. Put them guys. Repeat them. Choking, allergies, drowning.
She wants you to repeat.
Repeat at least 5. Position again. Yeah.
Choking, allergies,
Come on,
shock,
guys. You got
heart
it.
attack. You guys are saying
You got to
anything.
participate. Heart attack, stroke, these are the most common. Heart attack and stroke are the top.
Wow.
Drug overdose.
Wow.
All right? Intoxication. Alcohol. Intoxication. Somebody who drinks too much.
Yeah.
All right? Alcohol intoxication. Allergic reaction. Okay? Somebody who's at home got a heart problem and then there's something we call cardiac arrhythmia and their heart can go crazy and then boom, they pass out. Or their blood pressure can drop and they can pass out. A lot of things can do that, okay? Anyway, when somebody passes out in front of you, you need to know these steps about what to do. So what do you do first?
Check pulse.
No, you verify for safety. Make sure that you're safe.
Yeah.
Make sure that you're safe. If you're home, you're safe. But if you're somewhere there is a fire, is it safe?
No.
You have to get that person out of that area, all right, of danger, and then start doing what you're supposed to do. Okay? So you check for safety,
Check
and
for
then
responsiveness.
no,
No, you check for it.
I'm just reading.
yeah,
She-
responsiveness, and then ask for help. All those things. It's immediately. You do all these things. Responsiveness,
Together.
and then help. Get something to go. Get somebody to go and call 911 or get AED. All right. And then now you will then deactivate the emergency response system.
Look for no breathing.
And then if there is AED, you get the AED. And then now you start with the process of breathing and pulse.
You check breathing.
Okay? You check for breathing and pulse. Alright? So if somebody so the person breathes and has a pulse, what do?
You start the,
Rescue breathing.
No, you got a pulse and he's breathing normal.
oh, he has a
Oh, no,
pulse,
you-
he's
you
breathing.
just- you just
Wait for
You
that
just
to
wait.
work.
You just watch and wait.
Yeah.
Alright? You have a pulse, right, but no breathing.
You do rescue
Start-
breathing.
rescue
start
breathing.
You do rescue
CPR,
breathing.
yep.
That's all they need.
It's one breath every
30
6.
30
seconds for an adult,
and then
and for
two
the
breaths.
babies is,
30
2
pushes,
seconds.
2 breaths.
That's when you do CPR.
Right.
No, if you just rescue breathing, you just do the breathing.
Yeah.
Oh, okay. you just
Rescue
breathe.
breathing, you just do the breathing.
So when you do the breathing, what do you do?
What do you mean?
You
You just open the mouth.
Pull the head back.
You do what they call the head tilt and chin lift to open the
We're
airway.
going to do that.
And then you just
you lift their chin.
Right, and then you just breathe how many?
it's the breath lasts 1 second. It's one breath every 6 seconds. So that gives you 10 breaths per minute.
Oh, 10 breaths per minute.
Alright? Okay? And then no pulse and no breathing. This is big time problem. What do?
Come on, Lisa, what do you do? No pulse, il va gagner pulse, et il va gagner
No pulse and no breathing.
il va respirer.
Yeah.
There you go, CPR.
Okay. And then how many times you do the compression? 30? After 30 compressions, what do? 2 breaths. Okay? And you do that for how long?
2 minutes.
2 minutes. And every 2 minutes, what do?
Check.
Oh.
You recheck for pulse and responsiveness. Sometimes you're doing compression on the person and the person saying, oh! What does that mean? What does that mean? No, that means you stop. That person is good. Alright?
Because if you continue, they might punch you.
I will tell you that. Oh yeah, they'll tell you that. They'll tell you they'll punch you. Yeah.
And you're trying to help them.
Okay?
I'm fine now.
Alright, so while you're doing that, every 2 minutes you check your pulse, and then if you don't find a pulse, what do? You resume CPR again. And then
Keep it up.
you get your AED, which is very important. If there is AED, you have to get it. You know why you need the AED for?
Start that long chest, heart.
Yes.
Girls, he's asking
Yeah,
you a question.
You know the machine.
You start shocking.
Yeah, because shocking is very important. In
Yeah.
fact, this is
What
the most important thing. People who get a cardiac arrest, if they need to be shocked, the earlier you shock them, the better they do.
Yeah, because the heart can, yes.
Because you will resume the normal heart function. So early, we call that early defibrillation. That's why they have the AED in place. You remember that player? You watch football? You don't watch football. You know there is a player who played for Buffalo Bills. He passed out on the field, and there was a big deal on.
Yes.
It took about an hour to get him back. They were doing CPR and shocking him. So whenever you see they are doing this thing, and then they are on their way out calmly, that means that the person is back. All right.
Okay.
So they got him back by the time they got out, because it took them an hour. They do compression and shock him, and then they took him out to the hospital. Before they take him out, they have to get him back. Even if they are getting back, they have to keep shocking and keep chest compression. And when you see they are done, no more compression, and then no more shocking, you see them lifting the person, get the person in the ambulance, not doing anything. It's either the person is dead or they got him back. So we know they got him back if you know medicine, because they were just driving the ambulance to the hospital. That means he was back already. All right? Okay?
Now's the time to practice.
Yeah.
Kayla, you want to go first?
No.
Yes. Okay, so we choose you. We volunteered you.
He's gonna help you. You guys have to both do this.
That's the way you're gonna.
Lisa, you want to go first?
Hands on.
You're gonna understand.
Which one of you guys are gonna go first? You both-
Because you know
get over it.
exactly when you're doing the compression, where to compress and how to give the breath, okay?
Yeah.
How many of those plastics do we have?
Make room, right?
bunch of them.
Make room when you
There are plastics enough for
Oh, yeah.
everybody?
Or you can just mimic like you're doing.
Well, no, you can't. Maybe. How many plastics do we
I
have?
don't know, there's a bunch of them over there.
There's a lot
We're
of
gonna
them.
help you. Listen.
There is
Okay,
already
there's
one.
Akela.
You need the long bag.
You guys need to do it first for your badges. So go
Okay.
do it.
After that, you go in the middle.
I can give you a demonstration,
There
okay?
you go.
So somebody is passing out in front of me, or they call in hospital, somebody get a cardiac arrest, you go and say, hey, Mr. Smith, how are you doing? If Mr. Smith is responding, okay? And I say, does he have a pulse? If nobody can tell me, I check. Or I go to the groin. If there is a pulse and he's breathing, okay? I will do other things to find out why Mr. Smith passed out. I know because he has a pulse and then he's breathing, I don't have to do anything. Okay, that's the first thing, okay? The first one, breathing is normal and he got a pulse. I don't have to do chest compression. I don't have to do rescue breathing, okay? Because he might have other reason why he passes out. Let's see his blood sugar, he didn't eat well, his blood sugar goes down, he will pass out, okay? His sodium is low, he can pass out. Anything can make somebody pass out while they don't have cardiac arrest. Passing out doesn't mean there is cardiac arrest. You can pass out for any other. If your blood sugar drop in the 30s, you'll be out. And if they don't do anything, they have to check your blood sugar and replace the blood sugar, otherwise you'll be dead. Okay? Just the blood sugar.
From dehydration as well, right?
Yeah, you can pass out from dehydration. You don't have enough fluid. Your blood pressure drops, and you call that shock. When there is a point where the shock is so bad, you will pass out. People who got heart failure, their blood pressure can drop so low, they will pass out as well. Because you have to support them, do what you're supposed to do to elevate the blood pressure, correct the blood sugar, if somebody got a potassium of 1 or 0, the person heart will stop. Or potassium too high, the person heart will stop. There are a lot of things can happen, so you have to figure it out when you get to the patient.
Okay,
that's
sure.
for the hospital. But for you need to know the simple things, okay?
Okay.
Breathing, pulse. You don't do anything. Mr. Smith, I'm not gonna do chest compression on you. I'm not gonna give you any breath because you're breathing and you have a pulse. So now, number 2, Mr. Smith, he
Has no pulse.
he has a pulse and he's not breathing.
Okay.
So he passes out, and then you call for him. He's not responding. He's unresponsive, and you look at his chest. There is no chest rise, and you check his pulse. There is a pulse. Okay. What do you do?
Start breathing.
So you do the rescue breathing. The rescue breathing is, let me show you how you do it. Alright, so that's the person's head. There's no way you're gonna get the air in that person's chest like this because his neck is too straight. Alright, you have to do what they call a head tilt and chin lift. You do this, okay? When you do that, you open the airway. Because when the person's head is like this, you're blocking the airway. So you have to elevate the chin, okay? Head tilt and chin lift. And then this is when you start pushing air, all right? 1 second. But you do that 1 every 6 seconds. But when you do that,
That's when we have it.
if you have lungs, you would see the rise, okay?
You see, that's
You see it's not going.
Yes, it is. It's going up.
No, it's not good.
Yeah, there you go. There you go.
Yeah, but I need to do this. Alright?
Okay, let's leave it there.
But I think
It's
there's a
not
problem in
going
the
when it's
system.
like that.
Or maybe
This-
from the way you put it.
There is a
from
problem
the-
in the system.
Yeah.
Now
Well,
it's
maybe
better.
that is, yeah.
Okay. You see? Two.
Alright.
Wow.
Mr. Smith, Mr.
We have to give
Smith
two only.
is-
Just
Mr. Smith is on the way.
Now, if it is rescue breathing, it's 1 every 6 seconds and you keep going. Rescue breathing.
Oh,
Alright,
always you
1 every
use
6
the
seconds.
hand until
You keep
2
going
minutes.
until help arrives. Alright? So that's the way you give the rescue breathing, nothing else to do. And then
Oh, it's one. That's good.
and then after that, every 2 minutes you will check the patient to see how the patient is doing until help comes. Alright? So the next one is
Question.
no
Question.
yeah.
Now, once you do the rescue breathing,
Yeah.
if Mr. Smith now starts breathing,
Yeah,
stop.
you stop.
you stop,
Yeah.
and then you're just
Wait.
waiting for.
Yeah.
Okay.
Yeah. In the meantime, all these things, AD, you just, when it comes, you apply the pads. One pad is here, the other one is here. All right? And then you get electrodes and connect to the machine. And then you press the power button, it will analyze the person's electrocardiogram. If the person got a pulse, most likely the rhythm will be normal.
Okay.
The machine will tell you nothing to do. Don't do anything. Everything is good.
Yeah.
All right?
So how hard we should breathe in for this person who?
It's one breath, just one breath lasting 1 second. One breath lasting 1 second.
It's not good.
And then
Okay.
every 6 seconds.
But you took the hip back. There you go. Now it went in.
And you got 1, 2, 3, 4, 5, 6.
Breathe.
Just like that.
1, 2, 3,
1, 2,
4.
3, 4, 5, 6.
Breathe.
1 second. And then 1, 2, 3, 4, 5, 6. Right? And then you do that for 2 minutes. Alright, that means 10 breaths.
Yes.
No, not 10 breaths, it's 20 breaths.
Going to be.
It's 10 every minute.
Every minute.
So 20, and then you reassess the patient.
So what's the mechanism? We just try to breathe in for the people who can't breathe,
Yeah,
and automatically the system takes the air in and breath out like this, in and out, eventually.
Yeah. So what happened is when you breathe in, the chest is expanding. All right. Naturally, it will recoil. It will go down. All right.
Naturally.
And that means that person will exhale. It doesn't really matter. You breathe in, that chest expands, and then it will go down. And when it will go down, it will crush the lungs. The lungs are sponges.
Oh, I see.
So that
So
person
this
will
isn't a
exhale.
balloon.
Yeah,
Oh, look at
the lungs are like a balloon. Yeah. It's like a balloon. We inflate it, and then, then
So that's
you give,
why
you give
asthma-
oxygen.
I'm sorry. My mind just went off.
Go ahead.
So when you have asthma and you can't get enough air,
In fact, I'm glad you brought it up. Asthma is one of the reason people can go
Asthma.
into respiratory arrest. Very important.
so
Go
then
ahead.
that's why it feels like you have a brick in your chest.
Because you cannot move the air.
Yeah. And it
Because
just
your
feels
air
like
will-
you feel your chest feels so heavy. It feels like there's a brick in it.
Yeah.
And then when you finally start getting air,
Yeah,
the brick feeling leaves.
yeah. Because your airway is so tight. When you're able to open the airway and then the air is able to go in, you feel relief. In fact,
I feel
asthma,
like there's a brick.
asthma is a life-threatening problem.
Yeah.
If you cannot move air,
Uh-huh.
you're really close.
Yeah.
That's why a lot of people die of asthma every year.
Mm.
You cannot move air.
You just have to start praying. That was just what I used to do.
Yeah.
God, give me one more breath.
Any questions about this?
Just please, one more. You can still? No, any questions?
So the third one, you don't have pulse, you don't have breathing. What do?
You call 911.
CPR.
Can you do all those things we talked about? 30. That's right.
30.
Now, how do you do the chest compression? It's very important because if you don't do the chest compression right, you're not doing anything for the patient. You have to put your first hand in the lower, below the what they call the nipple line. That's the breastbone right here. It's the lower half of the breastbone. You have to put the heel of your hand right here. Okay? And then put the other hand on top of it. Okay?
That's on the left-hand side.
Now, are you?
So if you right-handed, you use the right hand. If you left-handed,
Oh,
But you
it's
can
in
do
the center?
whichever hand.
the center of your chest.
okay.
But it has to be on the breastbone, not the belly.
Not the belly.
Yeah, the breastbone.
Is the breastbone. You have your chest here, right here. Half. That's the top, that's the bottom. So here, the lower half. Okay, you put the heel of your hand and then the compression. 30 to 2, but it's very important. You have to press the chest about a third of the chest wall. See, if you divide the chest in 1/3, second, third, and third, okay? 1, 2, 3.
On the side.
Does that make sense? Yeah, the side of the person is very important. So 1. Okay, that's the first third, second third, and 3. So you don't want to press too hard and you don't want to press too little. If you press too little, you're not going to do anything. The blood is not going to get out of the heart and to go to the brain and other part of the body. If you press too much, you're going to crush the heart and then it's not going to be effective. That's going to be too much, okay? So you have to press exactly to that point, 1/3, okay? So when you do that compression, it has to be 1. You see? Say 1, 2, 3, 4, 5, 6, 7, 8. And the other thing is when you press, the same time, the same depth you go in, you have to let it go back up. You don't rest on the person's chest. You don't do this. You have to do this and then release. This, release. Go to recoil. This, recoil. This, recoil. When you recoil, you allow blood to come back to the heart. All right? If you don't allow the recoil, not much blood will come back to the heart. 1, 2, 3, 4, 5, 6, and your arm got to be straight. Okay, shoulder over the patient. Okay. So you do 30 like this, and then you're counting. 30. When you reach 30, you go. If you by yourself, you go with 2. But if you are 2 people, you do 15 2, not 30. 15 2. If you by yourself, you do 32.
Oh, so 2 people can do it?
Oh, yeah, the more people you have. You just want to kind of 6 people.
2 people.
They're going to
No,
do
no,
that.
he said 2 people, that's 15 each. Oh, 15, I mean, you know, like, I mean, you're switching. You're switching.
No, 15
No.
punches.
Instead of
2
doing 30,
breaths.
you do 15.
15
Right.
punches.
15
the other
to
breaths.
Right, and then you let the next person do it.
No.
No, the
15
person
to.
stay there.
That the rate changes
like-
when you are 2 people.
I'm here,
Oh,
and he stay there.
oh, I see.
If he's tired,
Because what
he
happened is-
switch, but he can't do that.
Because what happened is, if you by yourself, you do 15, you're gonna lose time, go for 2.
Yeah.
So the purpose is to decrease the interruption of
Yeah,
the
the
CPR.
CPR, okay.
Right? If you are 2,
Yeah.
you do 15, and that person do 2 breaths, and then
Yes.
you do
Yeah, yeah,
15,
okay.
2. All right. All right. Does that make sense?
Yep.
All right.
I'm ready to try it. since
Any
it's
questions?
Kayla, Lisa, any questions?
But we-
Right, because
but
remember,
did
you guys go to
plastic?
school.
Yeah.
Actually, had alcohol.
Because, you know, something, you know, a kid, another student,
That's like the hard part.
That's
Yeah.
the
It can
hard
happen.
part.
Yeah.
so that's when you're gonna put it
You
to
have
the
me one of
test.
those, let's get through the hard part.
All right?
But that at least we figure out if they know.
You have to put another one. No, it's not going to be because it has to be over there.
Yeah, that's why you have to put the, you have to put the, under the
You can't
plastic.
put it under here first?
Under the, no, it comes the other way.
Yeah, you guys need to